right, now we are at another hot take.
Yes, sir.
This hot take, we have a special guest on here, and this is Dr. Randy Howard, good friend, fraternity brother, as well as my wife's gastroenterologist. He's not mine because one thing he told me is that he doesn't scope his boys.
Good job. That's it.
So he passed me over to his partner. But this is Dr. Randy Howard. He's a native of Alabama, graduated from honors with from Tuskegee University, engineer. So that's his degree, electrical engineering. So we have a few other engineers on here. Med school at University of Kentucky. Completed his internal residency and fellowship at Case Western Reserve. So that's how you all have that Cleveland connection.
Cleveland.
Founded Gastroenterology and Hepatology Associates in July of 2005. And I already mentioned he's a member of Kappa Alpha Psi Fraternity Incorporated. And I can give a whole list of other achievements and what Doc is doing, but we're going to save that for another time because we're going to bring them back. This is just for the hot take. So thank you for joining us, Doc, especially at such a late notice.
Thank you,
Appreciate you inviting me.
Okay. Well, this specific hot take is pretty much poop questions that people are embarrassed to ask, and then we're gonna have responses from Doc. So there may be questions like, "Hey, we talk and joke about different things, but we may be a little bit embarrassed to talk about certain subjects as it relates to poop." So I wanted to bring the poop expert on here. So I'm gonna go ahead and start off with the first one. And before I go to that question, everybody knows that I'm a big fan of the squatty potty.
Yeah, that's why I laugh.
Yeah. Squatty potty. I even call it the Scotty potty because I probably have stole more than folks, and a lot of folks have it. So,
man, no disclaimer.
One of the reasons why I like it because it just makes it flow good. It makes it come out good, and it also makes that posture like that.
Yeah,
so my question is there a correct way to poop?
Yeah, I don't think it's necessarily a correct way, but the squatty potty, it actually works because it changes the angle of your rectum, so it allows things to have a easier flow out. And so we get some people are really constipated, and it helps. And so we've got ladies with rectocils, and that's basically a little weakening of the muscle wall, and their vagina kind of obstructs the flow, and so we've actually got ladies that sometimes have to place their finger in the vagina to straighten the angle so they can have a bowel movement. And the squatty potty, I mean, it actually changes the angle and just allows things to flow better. And most people don't need it, but some do.
Hey, you laugh, but I'm telling you, I travel with that mother.
I'm laughing at faces on the screen, man. That's all.
When you start talking about they gotta straighten it out, I was like, oh
Man, beat the wall.
we obviously go get real in this conversation. Yeah, that's what I was thinking. I'm about to learn a lot today, boy.
It's real though.
Somebody got the wall beat up. Somebody tore it up.
I'm a believer. How many people have purchased the squatty potty since I talked about it on here? One.
Oh. Don't raise your hand.
Don't put your hand though. Hey, I'm telling you. Hey, Ramsey's even been on road trips with me where I pull that bug right out the suitcase. Like, hey, I got the squatty potty.
Ramsey, do you ask to borrow the squatty potty? I mean, it's just your feet touching it.
Hey, it's right there. You just go put your feet up. Hey.
He made me a believer. Now after this conversation, I'm about to Amazon up over here on the left.
Hold on, no. Let me see if I can open up my Amazon.
That diarrhea flow.
So I can make some cheese on that.
Yeah. Hey, Scott, you should make an Urban Retrospect one.
Stickers on
with a fist on each side. Feet with a fist stop.
Yeah.
All right, now my next question is there an incorrect way to poop?
No, it's not necessarily incorrect, Ray. I don't like patients holding it. You know, you get kids, you know, they hold it and it just kind of, it creates a bad cycle. And so, you know, when you got to go. You know, I've got patients won't go in public, and I don't think that's I don't think that's good for your GI tract. But you know, it's everybody's bowel movement is kind of individual thing.
Dr. Howard, thank you for saying that. Thank you for saying that, because my wife needed to hear that, because she liked to criticize me. Because if I'm in public, hey man, if it's a toilet, I go, I make a bird's nest. I go ahead and sit on down and get that joint up out of me.
When you a big bird,
you should.
Hey, look,
you don't need more than a bird nest.
Hey, look, I tell them, I said, look,
a bird condominium.
Hey man, I tell them better out than in. It ain't a sin.
No, I mean, trust me, if you're not pooping, your life isn't great.
Good point. Yeah.
Hey, that's a T-shirt right there.
He might dropping already, dog.
T-shirt.
Hey, so that leads right into my question. What do you recommend to maintaining regularity?
You know, I'm a big fiber guy. And so, you know, I personally like Benefiber. You know, it's an easy way to get your fiber. You don't have to worry about it. But if you like Raisin Bran, you like, you know, bran and those type things, you know, that's, you know, because not only you get the benefit of your bowel movements, it decreases your cholesterol, all those things. So fiber is the way to go. And if fiber doesn't work for everybody, and sometimes it can make you more bloated. And so for those patients, there's stuff over the counter called Miralax that I'll recommend. Pediatric gastroenterologists use it all the time. It's totally safe. I'm not a big fan of stimulant laxatives like Dulcolax and Senna and those things. I'm not a huge. They'll actually change your colon, and so but Miralax won't do that, and it's pretty benign. But if fiber works for you, that's the safest way, and you'll also get extra benefit.
Is the Miralax for the fans, for people out there, for the viewers, is Miralax safe for kids? We use it here.
Yes, pediatric gastroenterologists use it all the time.
Okay,
and so you don't think you have to be a little, because we get a lot of kids, they hold it, or they, I don't do kids, but when we did kids when I was younger, you know, it becomes, it becomes traumatic for the mother. You know, the kids hold it, you know, they bleed, they tear stuff, and so, you know, when we did younger, we would stick a little bit of Miralax and a little orange juice and help them out a little bit. But it's about of the drugs we have is probably the safest things going.
Right. So I got another question then about this. I'm gonna have a bunch of questions.
That's right.
But what about what are they call suppositories, right?
I usually don't do suppositories unless you're really constipated.
Can you explain what they are, though? Can you explain how they work?
Yeah, I mean, essentially all you're doing is just like suppositories and enemas, you're putting osmotic fluid in your rectum. And so it allows fluid to come to, you can't have a bowel movement without water. And so it allows fluid to come in and then allow you to have a bowel movement. And essentially that's it. I mean, so a lot of times they'll do glycerin, which is essentially oil. But most of it is osmotic. That means that, you know, whether it's got salt, it's going to bring fluid into your colon so you can have a bowel movement. But, you know, I usually don't like doing those things unless you're really constipated.
Why is that?
You know, I just don't. I mean, if you don't have to put anything up there, you shouldn't.
It's supposed to
and
go
so,
out, man.
you know, and then my older patients sometimes mess it up, man. They don't do it properly, and you can hurt yourself.
Yeah.
All right.
I mean, one thing I did hear. I'm sorry.
Go ahead, Scott.
One thing I did hear about, and I don't know if you've been hearing about this, Doc, is with the Miralax. I guess taking it over time can thin out your hair. And
I haven't heard that because theoretically it should not get absorbed. But I won't say it's not because I don't know. But but it theoretically should be all in your gut. It shouldn't get absorbed. Okay. But there's always a possibility some of the stuff gets absorbed, but it shouldn't.
Shoot, thank you for Miralax. Because remember, when you used to have to go have colonoscopies, it was that Go Lightly or whatever like that. Now you put that Miralax in that Gatorade.
It gets the job done.
But you answer one question though. How you major in electrical engineering and being a gastro doc? That's more mechanical. That's more mechanical than
even engineer, man. I like tinkering. So a gastroenterologist, we got a lot of toys. And I like doing stuff with my hands.
You trying to electrify.
Man, I can't even lie. You sound a little sadistic. You said in gastro, you got a lot of toys. Like you enjoy torturing
toys,
people.
baby. A lot of toys.
Hey, another thing too, man. One thing I hate is when I'm trying to get clean, go to this little Kappa party. You take a shower, you take a dump before you take a shower, and then when you get done the shower, you gotta go again. That totally mess everything up. You gotta get back in. So my question to you is, why can't I completely empty my bowel?
You need some more fiber. The more fiber you have, the more you be able to evacuate.
Yeah, but you evacuate, but you're just going at different times, like.
Yeah, but the fiber is gonna bulk everything up and
all at once.
Yeah, and so you'll have better bowel.
I got you.
Doc, I got another question. Speaking of better bowel movements, man. So, and really kind of tags on to what you were just talking about. One of the things I tell my wife is that, when I'm really trying to exercise, eat better, all that type of stuff, when I'm drinking a gallon of water a day, like I try and tell her, like, man, that evacuates my system.
Yeah, it does.
On both, like not just me peeing, I'm talking about pooping. I gotta go. You know what I'm saying? One of them. You know what I'm saying? Is that normal for somebody to experience?
Yeah, the more hydrated you are, the better bowel moves. I tell people, even doing fiber, if you do fiber, if you're not hydrated, it's gonna be like passing mortar. Little country boys putting out mortar. It ain't gonna work well.
Yeah,
it won't. It'll be an unpleasant experience.
Yeah.
Ooh, okay.
Yeah, that was a good point there. That's all I got.
My question is, I'm asking for a friend who has hemorrhoids.
Mm-hmm.
Should your hemorrhoids bleed when you actually poop?
So hemorrhoids do, so that they're essentially veins at the end of you. At your anus, and so if you're having hard bowel moves, they can, or you even having diarrhea. The only thing with that is, you should get it investigated because there's a bunch of old studies, VA studies that most bleeding that come out bright red is hemorrhoidal, but there's a decent percentage of it is not. And so, we get a ton of rectal cancer that cats have been sitting on for a while, literally. Because they attributed their bleeding to hemorrhoids and it wasn't, or it still could be hemorrhoids and you still have something bad there. And so unfortunately, as Black folks, we die more of colon cancer, and so some of it is because we don't go to the doctor, but some of it's because we go to the doctor and the doctor doesn't recommend basic health screening like colonoscopy. And so, where I train at, any bleeding should be investigated, no matter how old you are. We're getting a bunch of, 30-year-olds with colon cancer in our clinic. So, it's just, if you bleed, you got to make sure there's nothing else going on.
Okay. All right. I got one. So what about those people who poop multiple times a day? I'm talking about 3 to 5 times a day. Is that normal?
Yeah, it's normal for them. So, I get patients that go every other day, go, 3 or 4 times a day, but that's normal for them. We consider constipation as not going, if you're going less than 2 times every other day, basically. once you get over 3 days of constipation, but everybody think of going a lot as diarrhea from a doctor. That not necessarily the case, more of a volume thing. So I've got patients that for normal for them, if they don't go 2-3 times a day, they're miserable. And so it's an individual thing. The thing as a gastroenterologist we don't like is when it changes. Say for instance, you normally go 2-3 times a day, and then now you only going once every other day. That's concerning.
What about the timing of it, right? So I can pretty much time my poops. I get 3 of them a day. You know what I'm saying? I get it after I drop my girls off.
Oh, he talking like he a professional shitter.
I'm not, I am, because I've always.
I know you talk like you been in the contractions.
But I've always had a active system. I know I need to go there. Then I need to go in the afternoon, and I need to go before bed. And if I don't get to go before bed, hey man, I'm fighting all in the bed, messing up the sleep for my wife. You know what I'm saying?
You take a shower before you go to bed?
Yeah, I take a shower, but I'm
just
hold
on. Hey, you Dutch oven your wife, man. You be
Have I Dutch oven my wife? But she sure has said she done she done turned over and got a whiff when that blanket lifted up. Zorroed her real quick, but my bad.
Dutch oven. Man,
yeah, it's the individual thing for you. So again, if and your body changes a little bit as you age, but if you go from the routine changes, it should get investigated. So whether it's your diet change or it doesn't mean bad things, but
what about just the timing of it? What about just the timing of it?
Yeah. Even say for instance, if you're regular, you do a morning, midday, to night, and then 5 years down later, your morning goes away. I still would get it evaluated because it's a change for you. Because everybody's a little different.
Okay.
He don't want to go see a gastroenterologist in Cleveland.
No, I've already, all jokes aside, I just had my what's the backside violation. I had my colonoscopy last summer, and I got another question. I got questions all about this.
Hey, you got that diarrhea.
This is a keen consultation.
Oh, 100%.
Hey, charging that co-payment, doc.
But I mean, so like one of the
make sure you send him a bill, Dr. Howard.
One of the dope things that I like, and I think
I only bill Q's.
But when I think it's dope having Black people from our society where we can actually have these conversations in a free and open environment. So that's, for me, that's what's going on. Like having what's it called again? Colonoscopy. So I need, what are the options in terms of what makes you evacuate? Because what I understand is you have pills and you got that solution. Now, I just got done telling you, I poop 3 times a day, bare minimum 2 times a day. You know what I'm saying? The amount of solution that they gave me, I was guessing is based on weight. So they think that I needed more. I needed less. I was completely, I was clear before I even had to finish the second jug. And what actually ended up happening is I was in pain by the end of the night. Like I asked the nurse or whatever at the desk, I said, once the process is done, do they vacuum this stuff the rest of the side of me, or what's gonna happen? Because I know how I go and I know what y'all just gave me. And what ended up happening is after the procedure that night, man, I went so much it was burning. You know what I'm saying? I was punching the wall. My daughters were like, man, what's wrong with daddy? Because I was in that much pain because I had to keep going and wiping and cleaning.
Oh,
what other options exist?
Was that after the Diddy party?
That's a little unusual. Yeah, that's a little unusual. So only because I always tell people most time when you leave, and actually I don't, if a patient in pain, to me that's a problem. And so because colonoscopy is safe, but there are bad things I can do to you. And so the first, if you're in pain, that would concern me. Because that's unusual. And so I mean I don't know who did your procedure, but if you're in pain, that's unusual for what we do.
Look, man, I gotta figure something out. I mean,
there are other ways for the prep. There are newer stuff that you don't have to drink as much. There are pills, but I don't use them because every time we try to do pills, we put people in kidney failure. So, but there are less volume new preps that you don't have to drink as much volume. But normally, and it's not weight based. It's not size based. And it's the funny thing is the guys in Cleveland that I trained on that did all of the prep studies back in the day, and they really haven't changed that much. We call it lavage because we're trying to make you poop your brains out, so we don't have to look at poop. If your dad is the only relative that had colon cancer, you really, unless you had a lot of polyps, you really should be every 5 years. Okay. Because we have a tendency, some cats have a tendency to overscope a little bit, and so
I got you.
And so if I would say 3 to 5 years if he's a decent endoscopist, and I'm biased. I'm a gastroenterologist. Some of the general surgeons do colonoscopies, and they don't do the volume that we do, and so just like anything else, the more you do, the better you are. And so we have at times we have to clean up some of their stuff literally because of missed stuff, and so I always throw it out. There are some good surgical endoscopists, but I'm a little biased on that.
Okay, I know one of the things that you see these commercials for is Cologuard. I don't know if you probably see it. So yes. Is that better than?
So for you, really, if you look at the fine line, you're not eligible for a Cologuard because you're considered high risk. And so Cologuard, the problem with Cologuard, and we like Cologuard as gastroenterologists because it gets people screened that wouldn't normally get colonoscopies. But if you read the fine print of Cologuard, there's a high false positive and a high false negative rate. So that means that 15 to 20% of patients that do Cologuards who have a negative test are going to have colon cancer or colon polyps. And so that's a pretty significant number. And so, but we see a lot of patients with Cologuard positive and a negative, and we've seen some with colon cancer that have had negative Cologuards. And so, for those patients who are unwilling to get colonoscopies, I think it's a great test because it's going to get a bunch of people that may die from colon cancer that would have not gotten screened.
Gotcha.
So I have a question about, we established red poop is bad, bleed is bad. Red poop is bad. But is there a certain color that your poop should be? What's the right color? Should we be concerned about our poop's color?
So there's a few. I do a lot of inpatient medicine. So there's only a few colors that bother me because most time your stool is gonna be the color of the food you eat, right? And so red we don't like, black we don't like, white we don't like. Anything else really doesn't do anything for me. And so because if you go out and have a little some collard greens, things gonna look sideways the next day. And so yeah, I mean those are really the three colors that I'm not big fans of.
Well, you talking about white? You talking about like the clay?
Yeah, you got me on that one.
Clay. That means your liver. Something going on with your liver.
Oh, okay.
AP, well, Doc, we reviewed a juice one time on here. It like some beet juice.
Yeah.
Hey, look, everybody out there, if you drink some beet juice, don't be scared when you see the results, man.
Oh yeah. I think you ain't gonna be and depending on the acidity, it might go a little. It might not be pleasant for a second.
I tell you this, funny thing you say that is after we did that beet juice, I went and had my colonoscopy done because I was like, something wrong.
Yeah.
I was like, Doc, I'm bleeding. He said, what? I was like,
now you juicy.
I didn't tell him I juice. It's bad. I went and had that colonoscopy done, because I was like, oh my God, what is all this blood? This blood. Oh my goodness. It was terrible. It was terrible.
Hey, did they put you to sleep with that when you did get a colonoscopy? They put you to sleep?
Yeah. We put you down.
Oh man, I think I got molested then, man, because he told me to look at the screen and stuff, man.
Nobody told you that. Nobody told you to go to.
Hey, you know who did his colonoscopy? P. Diddy. P. Diddy.
P. Diddy.
Even P. Diddy.
That was
take that.
I told you that we don't stop. I told you that.
I told you that we
I ain't dealing with y'all, man. We trying to have a good conversation here.
Well, Doc, funny thing, I got a question for you.
Hold on, man. I gotta tell them the year, man. Hold on. This happened in 2002, I think. And everybody keeps saying they put me to sleep, but I was looking at the TV screen. He kept saying,
"Yeah. 2002, we probably gave you a little something to relax you, and did it. So we talking about 22 years ago. Yeah, we probably didn't put you down right. And that, the problem with that is a lot of people don't come back. Yeah. And so if they have a bad experience, they don't come back. And so one of the things that some of the big insurance companies are doing, like Blue Cross and a few others, it didn't go well this past year, but they were trying to make us justify giving anesthesia for patients. And so when the data is rock solid that if you screen patients, colon cancer the rate goes down, but if they have a bad experience, they don't come back.
They'll come back.
And so when you see it come up and your insurance company is trying to save a couple dollars, they're trying to save it at your expense.
Okay. And the funny you said I did have Blue Cross Blue Shield of Tennessee at that time. So yeah, man, they didn't put me to sleep. I was wondering, man. I was like, because everybody else was saying they put me to sleep.
No, we put you down. No, back in the day, we would, whisper sweet nothings in your ear while we scoped you, but yeah, people screaming, it don't go well.
Hey, so that's why I told Ken we're at the age that we got to look at a doctor's credentials and his hand side.
Well, my hands are big.
See, wouldn't be my doctor. My doctor is a woman, a black woman with little fingers.
Right there at your crib.
In the same bedroom, you be Dutch oven.
I told him that you was gonna do it, baby.
Well, I got a question, Doc. Does the size of your poop matter? Because I'm a nurse and I've seen some people deliver bouncing baby boys. And goodness.
I'll walk up out of there, big dog.
We worry about little poop, like pencil thin poop. Okay. Then that's concerning. We worry because you worry about something constricting.
Okay.
And so, the smaller poops we worry. Bigger poops, you probably need to hydrate better and have some more fiber. But the smaller ones, pencil thin is a problem.
I got last question. This is off the. Why does the small poops hurt so bad versus the big poops?
That I don't know. But fiber is the way to go, baby. And if it's all dry and stuff, a little Miralax don't hurt.
Okay.
I got one question.
Listen, I just ordered me some fiber. I'll be fiber.
You mentioned something, and I read an article about it that you're getting a lot of people that's in their early 30s or late 20s with colon cancer now. Yeah. And I read an article on CNN how a lot of people that age range are catching it all of a sudden. Do you think, can you give a kind of reason why, you kind of thinking? Is it because they're eating all this ultra processed food or?
Yeah, it's kind of, you got a bunch of guys doing studies on it, but it's real. I mean, we see a lot of. I mean, I had this young lady. She died this past winter. She had like 3 young babies. She was like 33. Then no family history, it's probably diet related in some way. Whether it's I'm not whether it's our high fat Western diet, but that's the reason why they dropped the age from 50 to 45 is because we're seeing more and more young people with advanced cancers. The good thing about, not a good thing, but at least with colon cancer, you catch them early. We cure about everybody. But when we get you late, it's hard. And so actually, one of our best friends from undergrad died a few years ago. He got diagnosed in his early 40s, and one of my first cousins, he did fine, but he had colon cancer, and he just, he was just not feeling right. It wasn't like he had bleeding or any of those things. He just, he just was different. And my boy Leon, which, and some of it is about having a good primary care doctor. Just seeing subtle stuff like maybe having a little mild anemia, blood count just being a little bit low. Those are little things might clue you into, you got something going on that's not quite right. And the only thing that I think is probably a dietary thing, a Western diet thing. But yeah, I mean, getting younger and younger. I mean, I've been doing this about 20 years, and in the first 10 years, I mean, I seldom saw anybody under 40 with colon cancer. And, now I get, I don't know, 3 or 4 really, really young people every year.
Wow. Anyone else have any questions?
No,
have we addressed any poop concerns or all your poop concerns?
Doc, you got to come back, man. This was a good conversation.
We're definitely gonna ask him back just so we
because
we only were just touching on poop, and of course it's found in other areas, but there's definitely we haven't talked about Crohn's disease
or IBS
syndrome, etc. So we'll we hope you will come back to join us.
Yeah, I appreciate you having it. And
no problem.
And like I said, I don't discriminate against Qs. I just don't hang out with them.
Smart man. Smart man.
They're ruining the party.